Hi everyone, good morning all. Now we are going to see about obesity in health psychology. So in this video we are going to see what is obesity and why obesity is happening and what are all the factors which leads to obesity and what are all the health risk we face because of obesity and how we can rule out this obesity. So we are going to discuss this in detailed way by the stage by stage method. Okay, from the childhood age to the old age. Okay, to the old age we are going to see what is obesity and how obesity is ruling out ourselves. Okay. First, we're going to see what is obesity. So, obesity is in a complex interplay of factors which include genetical, environmental, and lifestyle choices, which different factors plays more protecting role at different life stages. Okay, obesity is not like only, it is not that only one single factor causes obesity. No. So obesity may lead because of genetic factor which is followed by our gene, which is followed by our ancestors, which is followed by our grandparents. Okay, and some obesity may cause because of our environment, the society which we are living, and some would be because of lifestyle choice. What are all the lifestyle choice which we chosen? Okay, which we are choosing. Okay, this is all about obesity, and many are becoming obese because of lifestyle choices and the environment which make the person to tend to have unhealthy food which leads to obesity, and one third part can be obese because of the genetic factor which is followed by their own gene from their ancestors or like from their grandparents. Okay, so childhood obesity is a large linked to unhealthy eating habits, low physical activity, and environmental factors like readily available high calorie foods and some sort of lifestyles. Okay, on the whole the obesity is like because of the lifestyle choices. First, in this we are going to see about the childhood obesity, and childhood obesity is because of less physical activity. In olden days, many are like they will be having a good physical activity. That is, they used to play good games. Mostly they play outdoor games, and they spend less time in the screen. Okay, but nowadays our childhood scenarios are like spending more time in the screen times because of less physical activity and unhealthy food which is like junk foods and readily available food which have a much calorie. Okay, much calorie we are turned to eating, and the children's used to give importance to colorly foods. Okay, which are attractive, which gives good perception look, and that triggers them to take the unhealthy food, and they make that an habit which leads to obesity. That is called a child obesity. And in older adults, obesity is because of they may be genetic or some metabolical changes which take part in their life. Okay, so that too can be less physical activity and some body composition like fat accommodation or decreased muscle mass or some social and economical factor also significantly contribute obesity. In older adults, they most probably because of their aging and because of their low stamina, they turn to take more rest. Okay, so they automatically reduce their physical activity. Because of that lack of physical activity, they turn to develop obesity, the fat which they are intaking or deposited. So because of that, obesity have been facing by the older adults. At sometimes some medications which can be hormonal pills or which some sort of medication which they are taking for their health can lead or that to lead obesity because of hormonal imbalance. So most probably because of lack of physical activity and medications and hormonal imbalance, old age people facing obesity is very common in this scenario. Thank you.